And welcome to the Dr. Bob Show. Are you worried about your heart? Do you think it may need to be evaluated? What will the doctor do to evaluate your heart? Get a chest x-ray? Listen to your heart? Electrocardiogram? Maybe an echocardiogram? Or a stress test? Or a Holter Monitor? Or calcium scores? Or CAT scans? Or even a heart cath? We'll be spending most of this show talking about what's available in a heart evaluation from your doctor and what information it gives him. My guest is Dr. Malcolm Foster, board-certified cardiologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about food allergies. Are your stomach problems, or your skin problems, or your headache problems due to food allergies? Well, maybe they are, maybe they're not. And what are the most common foods to cause food illnesses? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist, and we're going to be talking about evaluating the heart. Malcolm, welcome to the Dr. Bob Show.
Thank you. Happy to be here.
Tell me, first of all, exactly where is the heart located?
Heart is in the center of the chest, just behind the sternum.
And with it's behind there, does the chest x-ray show it good, or does it show more lungs or more heart?
It does. Well, the chest x-ray shows the two lungs on either side of the heart, but we actually get a good first look at the heart from the chest x-ray.
What does the electrocardiogram tell you about the heart?
Well, there's lots of information from the electrocardiogram. The rhythm of the heart, we get an idea if there's been a previous heart attack.
So the electrocardiogram can tell you a previous heart attack. Can it tell you if you're having one right then?
It can indeed. It's really critical in the emergency department.
And the kind of rhythm, what are some irregular rhythms that the electrocardiogram tells you?
So normal rhythm is called normal sinus rhythm, and then there are arrhythmias. Out of rhythm can be atrial fibrillation. There are other rhythms that are dangerous, like ventricular arrhythmias as well.
So you've got ones that you can expect to hear. How about if somebody skips a beat? Can you hear that?
We can hear that, and you can see that on the electrocardiogram, sometimes early atrial beats or sometimes early premature ventricular beats.
Your stethoscope, when you listen to the heart,
yes.
What does that tell you? The same thing as the electrocardiogram, or does it give you more information?
Well, it's complementary. So you hear the first and second heart sound, the lub-dub, is the closure of the mitral valve and then the closure of the aortic valve. You get an idea of the heart rhythm, the heart rate, whether or not there's a narrowing or leakage across a heart valve.
So you get all that by listening to the heart. You can hear
yes.
murmurs. What is a murmur?
So a murmur is turbulent blood flow, and that could be caused by a narrowed valve or a leaking valve.
Any special valve that causes more trouble than the others? How many valves are there?
Well, there are 4 valves in the heart, 2 on the left side, 2 on the right side.
When you say left side and right side, now the heart has 4 chambers, and 2 plus 2 equals 4. So tell me about the chambers of the heart.
Well, we can follow the blood flow. So the blood returns to the heart in the right atrium. It goes through the tricuspid valve to the right ventricle, out the pulmonic valve to the lungs, back to the left side of the heart to the left atrium, across the mitral valve to the left ventricle, and then out to the body across the aortic valve.
So it's the way the heart has of taking blood that's been used and is given off its oxygen and then throws it up to the lungs.
That's right.
And then the blood there gets the oxygen back, and then the heart can throw it out to the rest of the body again. How many times a minute does the heart beat usually?
So on average, about 80 beats per minute. Anywhere between 60 and 100 is considered normal.
60 to 100. If it gets over 100, what do you call that?
We call that tachycardia.
Tachycardia,
Yes.
T-A-C-H-Y.
Correct.
And that means fast heart rate. Or what's
Yes.
when is it a slow heart rate? What do you call that?
Well, by definition, it's less than 60. However, I should point out that plenty of healthy people, if you exercise, maybe do endurance sports, that your resting heart rate can be in the 50s or even in the 40s, and that's not necessarily bad, that actually might be good. So sinus bradycardia, or a slow heart rate, normal rhythm, can actually be a good thing.
Can sinus tachycardia, fast heart rate, be a good thing?
Generally, no.
How about if you're exercising, it keeps the blood from going, so it would be good. It would be good then.
Correct.
Otherwise, it means you're out of shape or something may be happening type situation. The electrocardiogram tells you, you said ventricular arrhythmias?
Sure, you can see either atrial arrhythmias, ventricular arrhythmias.
And those vary in their potential dangers?
Yes, particularly if somebody's had a prior heart attack or an enlarged heart, a weak heart, those arrhythmias become more serious.
Now, let's pretend that I'm a 35-year-old and I can feel fluttering in my heart. It just seems to boop, boop, and it's, it just comes on maybe 4 or 5 times a day, and you listen and you don't hear anything, then what do you do? What do you think of?
Well, if you are bothered by those extra heartbeats or palpitations, fairly common, we have a couple of different diagnostic tests to try to capture an example of that. So we might use a Holter monitor.
What's a Holter monitor?
That's where we actually record every heartbeat for 24 hours.
Whoa, how do you do that? Do you have to carry around an EKG machine with you everywhere you go?
A small one.
A small one. So are the wires hooked up to you?
Yes.
And you have this little small monitor?
Yes.
And it captures every beat?
It does. And so on average, about 100,000 beats a day, every day.
Wow.
So you might get 100,000 beats to evaluate and see how many extra beats or irregular beats that there are.
How do you know where to look on that Holter monitor? You have to look at those 100,000 beats?
We literally scan through the entire, all 100,000 beats. And
manually?
Well, we have assistance from computers now.
Ah, that's good. So the computer will sort of stop it right there, and then you look and see.
Yes.
Well, where does the extra beat come from, the palpitation?
Well, again, it can either come from the upper chambers of the heart, the atria, or the lower chambers, or even from the node which is between the chambers.
Are those dangerous?
Most of the time they're not, but they can be. And that's where we have to distinguish, is it a more benign arrhythmia or a more malignant arrhythmia or more serious arrhythmia?
So so far we've talked about sort of rhythms. We can hear the rhythm with a stethoscope, but with electrocardiogram you can see it. Tell me about what's an echocardiogram. What's that going to tell you? I hear the word, but I'm not sure what echocardiogram means.
That is an ultrasound test of the heart. And for all the information we get from the stethoscope, we get so much more information from an echocardiogram.
What's it like? Is it tell me about it.
Well, it's an ultrasound pictures of the heart. It's like taking an ultrasound picture of a baby before it's born.
Yeah, we've seen most of that. What does the heart look like on an ultrasound?
Well, you can see the chambers, the 4 chambers, the 4 heart valves. We look at the heart muscle to see if it's thickened or thinned. We see if the heart's enlarged. We see the aorta, the pericardial sac around the heart. It's very detailed.
When do you normally order an echocardiogram? When you're worried about what?
Well, some common symptoms, shortness of breath, for example. Common symptoms, fatigue, shortness of breath, not able to exercise or exert themselves, abnormal evaluation with a stethoscope. So if you hear a murmur, if somebody has high blood pressure, these would all be very common reasons to get an echo.
And so you can see in the echo what's going on with that. Yeah, do you ever tell me about a stress test. What do you do with a stress test? And I take it a stress test is you stress the heart and see if something goes wrong.
Generally, that's right. So typically on a treadmill. So we put on a treadmill, it makes it a stress test because they get an incline. So we have to walk up a hill on the treadmill.
And that gives you a tachycardia?
It does. It gets that heart rate up, and we try to get up as high as the person can tolerate. And we measure their blood pressure, and we watch their electrocardiogram continuously.
And that can tell you if something's going on with the heart, something's going wrong?
Yes, it's an indicator of ischemia, means not enough blood flow to the heart, indicating blockage.
And sometimes we inject nuclear dye. What does that do, and what does that tell you?
It is a tracer that circulates around through the body, but is taken up by the heart and shows us where blood flow goes to the heart muscle.
So does it give you more information than the echocardiogram, which showed the heart valves and murmurs and the way the heart beats?
They're complementary, and oftentimes we will get both an echo and a stress test with a nuclear scan.
When you do the echo with the nuclear medicine and you've evaluated to this part of the patient, does it give you almost all the information that you need?
Well, between an echo and a stress test with a scan, that's fairly comprehensive, yes.
Does it ever lead you into, well, I think we need to do a heart cath?
It does. If we see a cold spot or an area where the tracer does not get to the heart muscle, that's an indicator that there's not as much blood flow and that there may be blockage.
And so a heart cath would be able to tell us if there's blockage or where the blood flow is going.
That's right. It's a very detailed look at the heart arteries.
Before we get to heart cath, tell me about special CT scan. I hear about 64 slices. I hear about calcium scores. Tell me about what's a calcium score. Why is it important to the cardiologist for evaluation of my heart?
Right. Well, if you get plaque buildup in the arteries, almost always that involves calcium, hardening of the arteries. And that calcium score is the most sensitive test that we have to identify plaque in the arteries. Calcium score can identify plaque sometimes years before a stress test becomes positive.
Is the calcium scores where the coronary artery comes off the heart valve, or is it anywhere in the heart? Where do you measure that calcium score?
Well, anywhere in the heart arteries are on the surface of the heart muscle, and if they're normal and healthy, the calcium score should be 0. I've checked mine 3 times. So far, 0, 0, 0.
Keep it that way. Now, tell me, when do you do a 64 slice? What does that do for you?
So that's a much more detailed look at the heart and the heart arteries. It involves radiation exposure and it involves X-ray dye, similar to a heart catheterization, but it is non-invasive.
So you can get a good idea of what the blood vessels are like that way?
Yes, in some people better than others. So if you're heavy or if your heart's out of rhythm, the quality of a CT scan will not be as good. If you are a smaller person, can have a good breath hold, slow heart rate, the scan will be much better.
So far I'm amazed at what we can do to evaluate the heart. Let's go into a heart cath. Now tell me about a heart cath, because what information does it give you and how do you do it?
That's probably the gold standard for evaluating the heart arteries for blockage. We thread a catheter to the heart and give X-ray dye and actually look directly at the heart arteries.
Now, you thread a catheter. You had talked with me before about normally you would do it in a vein in an artery in the groin, but now you do it in the wrist.
We do. Most people now, we can go from the wrist. And it's anywhere there's a pulse, you can go backwards to the heart. And most of the time we can go from the wrist, which is very nice because afterwards you're finished, you put a Band-Aid on the wrist.
Huh, that sounds pretty neat. Is it hard to thread a wire, a catheter, all the way to the heart?
Generally it's not that hard, but we do it with X-ray guidance. So we can see what we're doing through X-ray.
And you can see where you are and which pathway to take. Now,
that's right.
When you do the cath, where do you put the wire to? Above the heart in the big arteries, or do you put it in a coronary? Tell me about where you put that cath.
So we start at the radial artery, brachial, axillary. We go to the aorta, and actually select the coronary arteries, the right coronary artery and the left coronary artery, and we place a catheter and put the X-ray dye directly into the heart artery.
So it's the dye that in the cath that will tell you what on the coronary artery.
We see the size, we see if there's plaque, blockage, narrowing, or sometimes enlargement, aneurysm formation.
If you see narrowing, can you tell 80%, 90%, 10% narrowing, and does that make judgment decisions that you have to do right then?
It does. And then further, we can actually go inside the heart artery. We can look on the inside of a heart artery. They're about 3 millimeters in diameter, but we can look with ultrasound and we can measure blood flow and pressure all the way to the tip of the heart artery.
It's getting more and more and more wonderful, really, isn't it? When you're doing a heart cath, when do you decide if you have to do a stent or balloon angioplasty? And tell me what those two things are, stent and angioplasty.
So a balloon angioplasty stretches open a blockage, and then you deflate and remove the balloon. A stent is expanded and is a permanent implant, but holds open that artery.
What keeps the blood from clotting?
Well, a patient takes medication to prevent that, and then a stent will heal into place, and a person will form a lining over the stent. Mostly we use drug-eluting stents, or stents that actually deliver medication to the wall of the blood vessel.
Now, if you've got a narrowed coronary artery and you put a cath through and put the stent in there, it reestablishes blood flow that the heart hasn't been getting. Does it make any challenges, or the heart suddenly says, thank you?
Well, the heart is happy. If it's a heart attack, for example, though, where the blood flow has been cut off by the heart attack, and we restore blood flow to the heart, early on it can be irregular.
When somebody's having a heart attack, they come in the emergency room, they got crushing chest pain. How can you do a heart cath if somebody is having a heart attack? I thought they're trying to die with a heart attack, and you're doing a cath in there. Well, why do you do that?
Because you can interrupt the heart attack immediately, right before your eyes.
To me, that's so wonderful. You've got a heart that suddenly doesn't have any blood supply, so it has chest pain. That's what the heart attack is, and then you reestablish it before the heart muscle dies.
That's correct.
Is there a period of time when somebody has chest pain, crushing chest pain, radiates up into the neck, come into the emergency room, electrocardiogram's bad, take them to the cath lab? Is there a period of time that you like to get that patient up to the cath lab by?
We do. We call it door to balloon time, under 90 minutes, and we shoot for under 1 hour, and we've been very successful.
In the old days, we just didn't have the ability to do that, and now the cardiologist, with all these tests to evaluate the heart and a cath to open up the blood flow, Malcolm, I just think it's just exciting. It makes goosebumps because you all do so much to help so many people. Thanks for coming and teaching us about how to evaluate the heart. I feel pretty good. I do not know what my calcium score is, so I need to see if it's 0. Thanks for coming to the Dr. Bob Show.
Thank you.
Great show. You'll want to stay tuned. We'll be talking about, can foods be interfering with your health? Headaches? GI problems? Skin problems? Could be. Stay tuned. We're about to walk into what I call the hallowed doors of the cardiac cath lab. Malcolm Foster, what procedures are done inside the cath lab?
Well, Dr. Bob, we do heart catheterizations and balloon angioplasty and stents and electrical procedures called ablations.
So a lot of activity goes on inside these doors. Let's see what it looks like.
All righty.
Here we are. So
Sir, this is the cath lab.
this is the cath lab. Now, Malcolm, is this what do you do with a cath?
So when we do a heart catheterization or a procedure, we go into the blood vessel with a needle and a guide wire and a small catheter.
Wouldn't you break those vessels?
The vessels generally are soft. There's some calcification involved, but we go in with a small but sharp needle.
Show me your floating table.
Sure.
I think this is amazing.
So the person is lying on their back typically, and this is called a floating table. And between the table and the image intensifier, which is the X-ray equipment, we can really get any number of projections in order to see the heart arteries, because the heart arteries are in a beating heart and they extend over the surface of the heart like a root system.
Do you have to be a good Xbox or a PS360 in order to work this machine?
Yeah, who knew? We have a little toggle down here, and probably my children may do better than I do.
Malcolm, this is fascinating. Now let's go back and see what some of the images show. Okay. Now, Malcolm, this is the image of the patient that's on the table right there.
Yes, sir.
Can you see this while you're doing the cath?
Yes, we see it live, and then we have the image repeat itself so that we can review it.
So show me which one of these are blood vessels and what's happening.
So this is the right coronary artery. So this goes to the right side and the underside of the heart. And this person has had some previously placed stents. So there's a stent here, and the stents look quite good, but now they have developed more blockage. So for example, this area.
Whoa, I can see that. That's suddenly you got a really skinny area there. That's a blockage, an occlusion you call it?
That's right. So we call it a narrowing or a stenosis, and that's due to plaque buildup. And that's somebody with a fairly tight blockage that's going to need to be treated with a stent.
Now, Malcolm, this is a coronary blood vessel that you're really looking at an enlarged view here of that same narrowing?
That's right, and this is from an image from inside the blood vessel called intravascular ultrasound. We can see very precisely the size of the blood vessel. We can see how much plaque buildup there is in terms of the percentage of blockage and the type of plaque that's inside the artery.
Now we're ready to go with the stent. This patient going to do well?
This patient should do very well.
I want to thank Dr. Malcolm Foster for his excellent discussion on evaluation of the heart. And now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, how common are food allergies? Yeah, that's such a good question. Everybody seems to worry about their health and do I have food allergies? I've got migraine headaches. Are they due to food allergies? I've got an irritable bowel. Is that due to food problems that I'm having? My skin is dry and itchy. Is that a food allergy or is it just something wrong with my skin? Is arthritis due to food allergies? What are really food allergies and what are their symptoms? Well, there's an increased incidence of food allergies in the United States. It's gone up some 18% in the last 10 years. Why is that? We don't know. The most common foods to cause allergy problems, there's 8 of them: egg, wheat, corn, milk, soy, fish, shellfish, peanuts, and tree nuts. Now, those are responsible for 95% of food allergies. The predominant food allergy symptoms can vary. It can be anything from the eyes, which get red and itchy, the lips can swell, the skin can break out in hives. Or it could be people get diarrhea, or people could get cough and wheeze and shortness of breath. Those are more anaphylactic reactions. Peanuts is the main offender for serious food allergy problems. There's some 1.5 million people in the United States that have peanut allergies, 50 deaths per year. Most of those deaths are if you go to a restaurant where nobody has told you have food allergies or you don't know you have food allergies, and there's been some peanuts in a salad bowl or some little peanuts in some cookies or dessert or dip that you weren't aware of and you didn't notify the restaurants. Restaurants do a very good job now of recognizing the importance of having peanut-free meals. Now, other causes of serious food allergies, we get into milk is a common cause, and also eggs. Now, let's talk about wheat, because wheat can cause allergies, skin allergies, eczema, but more common, it's a gluten sensitivity that can cause a sensitivity, not a true allergy. That's celiac disease, where gluten sensitivity, people can, if they eat wheat, they eat the gluten that's in the wheat, and that causes the GI tract, the small bowel, to change where it doesn't digest food well, and we get chronic diarrhea. Chronic diarrhea, think of gluten sensitivity, think of celiac disease. Other illnesses that foods can cause true allergic reaction. There's a medical word we call eosinophilic esophagitis. That's where there's allergy cells in the esophagus that cause heartburn and indigestion. 50% of those people have food allergies. There is atopic dermatitis, eczema. Frequently, foods will flare those. Next, if you've got food allergies, itching, food problems, probably going to have those worked out with an allergist who can do skin testing or can get blood work for foods and can lead you on the path to better health. Question number 2, Dr. Bob, what is a norovirus? That's a good question. Norovirus is a single-strand RNA virus that's the most common cause of gastroenteritis in the United States. It causes problems with nausea, vomiting, and diarrhea. There's epidemics. It's very, very widely spread. CDC came out with a very interesting food-borne illnesses. The most common food to cause problems would be produce. So that could be lettuce, or it could be fruits, and it could be vegetables. You get in the produce part. So you need to be sure that those are washed. Milk is the next most common cause. Chicken causes serious problems because it's got salmonella or listeria that could be there. So be careful in your washing. Be sure you cook well. Be sure that you're washing the produce well. If you buy vegetables that have already been triple washed, you probably don't need to wash them in your kitchen all the time that we have for this show. Hope you've enjoyed it like I have. Remember, we need to be exercising. It's the most important thing you can do. It lowers your weight, gets rid of that stress, and you'll sleep better. You need 8 hours of sleep. If you get that 8 hours of sleep, you'll feel much better, and the people around you will feel better. If you're not getting 8 hours of sleep and you can't figure out why, talk to your doctor about it. You may need to see a sleep specialist. We also know that eating proper is so, so important. Eat less food and eat better food. And most of all, what do we like in the Dr. Bob Show? It's that laughter in your life. Laugh and giggle with people around you, and you will stay healthy.